there was a group of physicians, health professionals, researchers, patients who came today and said that this task force is completely working off of old data, that it is slow to respond, and that it's hurting the health outcomes of Canadians. Do you think that this task force needs a revamp?
Well, I think let's take a look at what is going to be done, what recommendations come forward. That's looking to happen at the end of May. And then thereafter, we have a public consultation period where we can take a look at the evidence that's gathered and make sure that the right science and data was looked at. Any decision we make as a federal government will, of course, be rooted in science and data, and there will be that public consultation period. So let's take it one step at a time. Let's take a look at what they report. Once they report it out, then we have an opportunity to evaluate it and take a look at both its recommendations and the future of that task force.
The task force, these groups say, though, is working off of incredibly outdated data, some breast cancer screening information from the 1960s. Like, they say that this entire task force needs to be rebuilt. Is that something that you would consider doing if you feel that this next round of recommendations is not up to speed with the latest health information?
Well, the thing, of course, this is operating at an arm's length. I think it's appropriate that I continue to let it operate at an arm's length, and I don't want to be prejudicial to their findings. Let's take a look at what their findings are, and they'll present the evidence they used for their findings and recommendations. Then we're going to have that public consultation period where we're going to get an opportunity to really dig into the work that they did and what they based it on. And then, of course, we'll have the opportunity as a federal government to make a science-based, data-driven decision that's right to protect women's health. This is an area that's incredibly important to all of us. And then after that, then that's a good time to look at the composition of the committee. But I would say that getting ahead of ourselves, and guessing what the committee might recommend or what evidence they might use, I can understand everybody's concern, but we have to actually wait to see what's true and what's real before we get into a position of responding.
But their guidelines right now, many provinces have just basically said we don't agree with these, and they've gone and done their own guidelines. For example, breast cancer screening is a big one. So are we not at the point where we already love a construction site on the hill? Are we not at the point where the federal government could be taking action on this now as opposed to waiting for more recommendations and more consultations for things that provincial health authorities have already decided need to be changed? Well,
the decisions we make have to be based on evidence. It has to be based on independent analysis, scientific analysis of data and facts. And so we have an arm's length process. This is outside of government that's making those recommendations. They're making them imminently. It's going to be at the end of May, so we don't have to wait very much longer. And then we're going to have an immediate public consultation process. And and I want to act as fast as possible as the health minister to make sure that we have the best guidelines informed by science and data. But even if I get a little wobbly on what I'm seeing, I have to let that process play out, because it's extremely important that it be at an arm's length. It's extremely important that it be driven by science and data, and that I don't allow speculation to interfere with the process, particularly when we're nearing a conclusion and the ability to act.
Okay, thanks for stopping.
Thanks so much.
I appreciate it. Okay. There was a group of physicians today that came forward, patient groups, researchers, that say that this task force is using really outdated data, and when it comes to screening, they really want the task force to be kind of busted down and created anew with more researchers, more physicians. Are you familiar with the task force? Do you have concerns with it yourself?
Yeah, I think we heard testimony at HESA probably 2 months ago now that related specifically to the breast cancer screening guidelines. And what the suggestion was at that point in time, and of course the report's not finished yet, really related to the use of outdated studies and inclusion of patients who perhaps were categorized in the wrong groups. That's very concerning, of course, and we all know very clearly that the use of technology has changed precipitously in terms of, I'll stick with breast cancer screening, the use of MRIs, the inclusive use of digital mammography and ultrasound. Those things have become incredibly important, so that we have become better at detecting disease in young women. And I think it's important that there's a very, very close look at that. So once the report is done that we're still working on now on women's health, then I believe we'll have some recommendations with respect to that. So it is an incredibly important time for women. here in Canada who are suffering with breast cancer, and if we do have that ability to detect it early, that's something that we need to ensure is happening here in this country, because this is a disease that's going to affect at least 1 in 9 women during their lifetime, so it's incredibly important. So as I said, we've addressed this at Health Committee, and once that report's done, then we'll have some recommendations. So thank you.
Do you think that the task force right now should be revamped, though? Some of these groups are saying a lot of provinces have decided they don't want to even use these national guidelines. They're coming out with their own screening, but family doctors are still using these national guidelines.
Yeah, when it's hard for me to take off my politician hat and be a family doctor again, but being a physician is a difficult job, but that discussion needs to happen between the physician and the patient with the knowledge of the guidelines in the background. And I think that's the most important part here, is to understand that the guidelines are guidelines, and that understanding the science is part of the job of the physician that exists with it. That's not to say that we don't attempt to ensure that the guidelines are as good as they possibly can be. Absolutely, but I'll reflect back again on what we saw at Health Committee and to understand the importance there, to look at the weight of evidence on both of those sides. But much has changed since those studies were produced, and I think that that's going to be an important consideration, the recommendations that we will have, absolutely. And you'll see more coming out of Health Committee on that. So thanks for your time, I appreciate it.
Thanks for stopping, I appreciate it.